In our previous session, we discussed about the revenue cycle management, or you can say RCM. So it is clear now we have basic understanding of RCM process. Now we know the RCM, but what are the benefits of RCM? Because if you are implementing any process, if you are implementing any model, then you should be aware of the benefits, because of benefits only we are going to implement this, right? So what are the benefits that RCM provide to the healthcare industry? This is our today's topic. Okay, and this is also very important topic because it might be a question for you in an interview round, like what are the RCM benefits? Because if you are implementing, you are joining RCM team, then you should be aware of the benefits, right? So let's see what all points we have here. So for RCM benefits, we have first point we have is improved cash flow. Now what does it mean? Okay, just think, if you are implementing your RCM process, then how it will help? It will help us by streamlining the billing process. Now what does it mean? If you are using RCM, then it will provide a smooth process for billing, because it will take care of all the claim submission, all the corrective measures if needed. So this will help us to streamline the billing process. And also it reduces the time between providing the services and receiving the payment. And this is the one of the best thing we can implement with the help of RCM, because now we are reducing the time between the services provided and the payment received. So lesser the time between the service provider and payment received, higher the productivity of your organization. This result in a more consistent and predictable cash flow for the healthcare provider. If you are implementing a proper RCM process, then what it will do, it will improve it will provide a consistent and predictable cash flow for your healthcare providers. Why? Because now we are taking care of all the process, so we have some idea like what is wrong, what is right. So that will provide us a proper predictable cash flow for the healthcare providers. So this is the first point. Now we have second point, which is faster reimbursement. Now what do you mean by reimbursement? Reimbursement is something like you can say it is the most important factor of the coding process or the entire RCM. Okay, because efficient RCM system, because a reimbursement is a process which is completed after claim submission, right? So here it is mentioned, efficient RCM system facilitate timely claim submission, processing and reimbursement from the insurance payer. Okay, so what it will do, it will provide a timely claim submission, because if we are following the proper steps, we are checking everything time to time, so that will help us to submit the claim faster. And though the result, the same thing, like the service provider payment received time is reduced. Also, this reduces the risk of delay payment and enhance the financial health of the organization, because if you are performing faster reimbursement, then there would be very less chance of payment delayed. Okay, and though it will enhance your financial health of your organization. Then we have reduced claim denials. By ensuring accurate coding, thorough insurance verification and adherence to the payer guidelines, RCM help minimize the likelihood of claim denials. Why? Because now we are doing the thorough insurance verification at every step, right? We are following the proper guidelines. We are taking care of all the necessary things that comes under the RCM process. So that will help us to minimize the likelihood of the claim denials. There would be very less number of denial, which leads to the fewer instances of rejection, claim rejection, and the need for the time consuming appeals. So if you have already reduced your claim denial, then there is very less chance of rejection, right? So this is one of the best advantage of RCM, that it reduces the claim denials. Then comes enhanced productivity. So just think, if you have already implemented 4 above points, then it will for sure enhance your productivity, because now we have improved cash flow, we have faster reimbursement, we have reduced the claim denial. So it will for sure enhance your productivity. Here it is mentioned, automation and optimization of RCM processes contribute to the increased efficiency. This allows healthcare staff to focus more on patient care and less on the administrative tasks, leading to improved overall productivity. So this is very important factor. Why? Because if you have already implemented the proper RCM process, then there is very less chance that anything goes wrong, and due to which now the healthcare staff can focus more on patient health instead of thinking about other administrative tasks. Now he is focused, they are focused on their treatment process, providing medication and all thing, because now they don't want to spend more time on administrative tasks like preparing the billing, taking care of the data, because a separate team is there to take care of all those things. Okay, and now they are free from their mind, like they have only one thing to do, which is patient care. So this improves the overall productivity of the healthcare industry. So these are the 4 points. Now we will say few more points, which is increase revenue capture. RCM help identify and capture all billable service, ensuring that healthcare provider receive appropriate reimbursement for the care provided. Okay, so if it is providing proper you can say reimbursement for the care provided, then for sure it will increase your revenue as well. This maximize revenue potential and contribute to the financial sustainability of the organization, because if you are following proper guidelines, proper standards, okay, and if you are taking care of all the steps of the RCM, then it will for sure enhance the financial sustainability of the organization. Then comes compliance and accuracy. What does it mean? RCM system aid in maintaining compliance with coding guidelines, billing regulations and payer requirement. This reduces the risk of audit, penalties and legal issues, promoting a culture of accuracy and integrity. So if you are following proper guidelines, you are taking care of billing regulations and the requirement of the payer, then it will for sure reduce the risk of audit, penalties and legal issues. And this promotes the culture of accuracy and integrity. Okay. Then we have another point, which is enhanced patient experience. How the patient experience would be enhanced? Because now patient is aware of all the things which is provided to him, what all charges are applied, and for what purpose or for what reason he is charged extra, if there is any extra charges. So these all things is clear to the patient, so there is very less confusion. Okay, so just focus on this point. A well managed RCM process result in transparent and accurate patient billing. This in turn contribute to a positive patient experience by reducing billing error, avoiding surprise charges and provide clear financial communication. Okay, so this is very important factor, because now patient know like there is no billing error, he know that there is no surprise charges, and also there is a clear cut financial communication between the healthcare providers and patient. Now he know what all services are provided to him, for what all services he is charged for. So these are the points. Then we have data analytics and reporting. As we are implementing proper healthcare process by including the RCM, revenue cycle management, then its system generate a comprehensive report and analytic that offer insight into the financial performance of the healthcare organization. This data can be used to identify trend, make informed decision and implement the strategic improvements, because now we have good data, right? So by analyzing that data only, we can improve the productivity, we can take the proper decision, even we can predict the upcoming trends, so which will help further in research and analysis phase. So this is also included as a benefit of RCM. All right, Now next point is cost saving. Automation and efficiency gain in RCM process can lead to a cost saving by reducing manual error, minimizing denial, and optimizing resource allocation. Healthcare organization can operate more effectively, more cost effectively, because everything is automated. We are taking care of everything and at every step, right? We are checking all the required things. If there is any error, then we will try to reduce that. We are also minimizing the denials and the risk of claim rejection. We are optimizing our resource allocation. So these all factors are somewhere helping in cost saving, because if there is less number of errors, for sure cost will be improved. If there is less denial, for sure the cost will reduced. And in case of optimized resource allocation also help us to save our costing, and which makes the system or the organization, which makes it easier for organization to operate in more cost effectively. Okay. Then we have adaptability to regulatory changes. RCM systems are designed to keep up with evolving healthcare regulations and coding guidelines. This adaptability ensures that the organization remains compliant with industry standards and avoid financial penalties, because now we have proper compliance, we are following proper compliance, we are taking proper care of regulations. Also we are making it very sure that we are fulfilling all the guidelines provided by medical code, medical standards, right? And these all things reduce the chance of financial penalties, because if there is no error, if there is no fraudulent, then there is no fine or penalties for the healthcare providers, right? So everything is organized, everything is proper, and even though customer is also know, even though patient is also know, like for what services he is getting pay, he is supposed to pay, what all things he is requiring. Okay, so this help us in reducing the financial penalties. So adaptability of to regulatory changes is also comes considered as an advantage of RCM process. Then we have streamlined patient billing. RCM systems simplify the patient billing process, as we know, because everything is smooth, everything is in phase process, so everything is clear, right? Providing clear and easy to understand statement. This transparency reduce confusion for patient and enhance the likelihood of prompt payment. Because if billing process is smooth, if the customer is aware of what all things he is supposed to pay, what all services is provided to him, then he will for sure pay the process the payment process earlier. There would be prompt payment for all the services he has received, because now there is no confusion. He is quite clear. He is able to understand all the statements provided by the healthcare departments. He is aware what all things are provided to him, for what all things he is charged extra, how the billing is processed, what all treatment he has received. So all these things is clear to patient, and though he will go for the prompt payment. Then we have integration with technology, and this is the last point, I would say. Not even the last, because there are many advantages. You can't cover all the advantage in single session, right? But we are focusing on important factors which comes into the picture when we are learning about the RCM thing, right? So this is also one of the advantage for the RCM benefit. One of the advantage of RCM, which is integration with technology. RCM often involves the use of technology. Okay, you know, we are using some software in order to perform coding. We are using some software in order to process billing smoothly. Also, we are taking care of all the compliance and guidelines. So these all things require some technology, and we are using it. So if RCM is involving the use of technology, including the electronic health record like EHR and practice management system, then it will be then RCM is helping and integrating with the technology. Integrating with these technology improve communication between different departments and facilitates the seamless data exchange. Okay, so these are the all point which we can consider as a benefit or advantage of healthcare RCM for healthcare industry. Okay, so what I would suggest you, I would suggest you to take notes of these all points, because these are very important in terms of interview questions. Because if you are preparing for some interviews related to the medical coding, I would suggest you to take notes of this. We are going to discuss about the challenges which are associated with revenue cycle management or RCM. Okay, so far we have learned about the basic things about RCM, what is RCM and what all steps are involved in for the RCM process, right? And also we have discussed the advantage or need, or you can say benefit of the RCM cycle. Now we will discuss few things which we can consider as a challenge while implementing the revenue cycle management or RCM. Okay, and this is very important in terms of interview questions. Like there might be some questions related to the challenges, like what all challenges are there for the revenue cycle management or RCM. Then these points will help you. Okay, so let's see what all things we have noted down here. So the first point, or the first thing that we can consider as a challenge is coding accuracy and compliance. Why? Because everything is dependent on coding. If the coding is not accurate, then how can we expect that the proper reimbursement will be proceed? Because coding is very essential thing. And same goes with the compliance. If you are not following the regulation, if you are not following the proper rules or standards, then how can we expect that it will process the proper reimbursement? Okay, so this is very crucial point. And same here I have noted down, ensuring accurate coding of medical procedures and diagnosis is crucial for proper reimbursement. If your coding is not correct, then you can't think of the proper reimbursement, right? Then the second point is staying compliant with constantly changing coding requirements such as ICD-10 updates can be challenging. As you know that we are going to follow some coding standards, ICD, CBT, right? So you should be aware of that, like what all changes are made, and like you should be updated for those things, right? Otherwise that will be also considered as your challenge. Fine. Now second thing is staff training and education. Doesn't matter in which domain you are working, doesn't matter in which sector you are working, if you are implementing any process, so proper training and education is required. Okay, because if you are working with a multiple team members and they are not trained, they don't have that much of educational knowledge regarding your whether coding process or RCM process, then how we can expect them to work on, right? So staff training and education is also considered as a training factor, challenging factor, because if it is not there, then for sure it would be a challenge. So same thing here I have noted down, continuous training and education are essential for coding staff to stay updated on coding guidelines and regulations. Fine. Then we have noted down here, higher turnover rates can contribute to a lack of experienced coders. Fine. So this is also a point for staff training and education. Then we have integration of technology. Implementing and integrating coding software and electronic health record like EHRs can be complex and costly. Why? Because if you are implementing anything without involving the technology, then for sure it will increase your time of process, right? Because technology we should use in order to minimize the time and efforts by the humans, right? But if you are implementing that thing, let's say electronic health record, then in that case one thing would be it might be complex for the team, right? And another one is that it would be very costly, because if you are using any tool, then you should pay for the tool, right? And if there is any bugs, then you are supposed to pay for that, for resolving those also, and designing. So there is lots of cost factor that affect your integration of technology. Fine. Then we have compatibility issues. As I told you that we are going to use some software. You know that during the coding, medical coding, billing process, the team is using the software and tools. So if there is some compatibility issues, because we are at the end we are going to transfer multiple information from one place to another. So if from one system, if you are working with a different system and there is some kind of compatibility issues, then it will surely affect your efficiency of the RCM process. So this is also at one kind of challenge for RCM. Fine. Now we will move to the next point, and the next point is denial management, and very crucial point. Okay, just keep a note of it. Proactively managing and reducing claim denials is crucial for maintaining a health revenue cycle. Why? Let's say you have started one process and due to some issue there is a denial occurred. Okay, and if you are not paying proper attention to it, and if you are not trying to fix your actual issue behind that denial, then for sure it will affect your revenue cycle. Because if there is a denial, then we are not supposed to ask for the reimbursement, because first thing is that we should remove those denials. So same thing here I have noted down. Proactively managing and reducing claim denials is crucial for maintaining a health revenue cycle. The next thing is identifying and resolving the root cause of denial can be time consuming and require effective communication with payers, right? Let's say if there is any kind of denial occurred, so in that case we are supposed to identify and resolve the root causes of the denial. Otherwise maybe in next process also again it will be considered as denial. So for that we should identify what is the root cause of that denial, and also a proper effective communication with payer is required in such cases. Okay, because they will help you what was the reason behind denial, and then you will figure out at your end what was the mistake you have implemented, and then later we will implement the same. Okay, fine. Then we have timely claim submission. Delays in claim submission can lead to a delayed reimbursement and negatively impact cash flow, which is fine, right? If there is a delay in submission, then for sure it will affect your reimbursement process and also affect your cash flow. Fine. Then we have streamlining the coding and billing process to ensure timely submission is constant challenge. Okay, so there should be a streamlined process between coder and biller, because that will ensure the timely submission. Otherwise it will be considered as a constant challenge. Okay, so streamlining the coding and billing process to ensure timely submission is constant challenge for RCM process. There should be proper communication, right? And everything like proper submission should be there, timely submission should be there, then only we will be able to proceed for the further steps. Then we have payers and variability. Understanding and navigating the specific rules and requirement of different payers can be challenging. Just assume you are working with a multiple client. Now one client is expecting some other rules to be implemented, and they are implementing some other type of coding standards or whatever the thing is, means their requirement is bit different. Now next time when you work with another client, they might expect something else. Okay, so understanding their rules is very important, and like rules and requirement for different payers should be adaptable for you, otherwise it would be your challenge. Then we have payer policies and reimbursement rates may vary, complicating the RCM process. So this is also one challenge. Payer policy and reimbursement rate may vary from client to client, and if it is varying, then for sure it would be your challenge for RCM process. All right. Then comes the picture of audit risk. Regular audits, whether internal or external, are necessary to ensure coding accuracy and compliance. So proper audit is required in every factor because if you are not doing proper auditing, whether it is internal or external, then we are not able to ensure that whether the coding is accurate or as per the compliance or not. Okay, so audit is very important, and if you are not implementing it in a timely manner, then it would be one of your challenge. Okay, next point is same thing here, just focus on the second point. Preparing for and responding to audit can be time consuming and resource intensive. Fine, so these are the 2 points that comes under audit risk. Then we have revenue leakage. Identifying and addressing the areas of revenue leakage such as missed charges and undercoding is crucial for optimizing revenue. So we have that goal, right? We have to optimize our coding, optimize our revenue process, right? Then only we can process the proper reimbursement and payment would be processed. So for that we should be aware and we should identify and address the areas of revenue leakage, which could be missed charges or undercoding. Fine. Then we have developing strategies to plug these leaks without compromising compliance is a constant challenge. Okay, all right. Then we have interdepartment communication. This is a very important factor that may become your challenge during RCM process, during implementing the RCM process. Why? Because effective communication between coding, billing and other department is essential for a seamless RCM process. Just assume you are working like there is a 2 department, although there are multiple department that comes together to work for this process, but for now just focus on coding and billing team. Let's say coding team is not providing the correct information to the billing team. So in such case, if billing team is not going back and they are not collaborating with each other to discuss the requirement to fix the issue, then it would be then it would leave a big impact on the entire process, and it might change your the timing of the reimbursement as well. Okay, so effective communication between coding, billing and other department is essential for a seamless RCM process. Then we have miscommunication or lack of collaboration can lead to errors and delays in reimbursement, which is fine. We just discussed, right? If there is any kind of miscommunication between any of the department, not only between the coding and billing, it could be process, it could be there with any process, any department like. So miscommunication or lack of collaboration can lead to the errors and delays in reimbursement. Then we have changes in healthcare policies. Rapid changes in healthcare policies, regulations and reimbursement model can impact the revenue cycle. Adapting to these challenges and ensuring compliance with the new requirement is an ongoing challenge. Okay, so as we know that we are totally dependent on the policies, regulations, right? So rapid changes in the healthcare policy, regulations and reimbursement models can impact the revenue cycle. So for that we should be aware of proper policies. Although we are updating, like we are supposed to update our team with all these information, but if there is a frequent healthcare policy changes, then for sure it would be a challenge for the RCM process. Okay, so yeah, these are the all points which I would like to discuss with you in terms of challenge associated with the revenue cycle management or RCM. I hope this is clear to all of you. Now one more thing I would like to share with you, like from today onwards, what we will do, I will put one question here, and this is just for preparing you for the interviews, because I'm assuming that you all are somewhere preparing for interviews or for CPC examination or any other type of competitive exams. So in that case, it is always required to understand the problem statement and to answer the basic questions, right? We are going to discuss all those points which we need to look while selecting a RCM process. Okay, just think as a professional and just assume a scenario where you are supposed to select a RCM process for your organization. Okay, now what all points are there which we need to take care of? which we need to consider while selecting a RCM process. Okay, so this is the topic for today, what to look when selecting a RCM system. So we have noted down a couple of points here. One by one we will go through each point and we'll understand the requirement, like what are the factors that we should take care of while selecting the RCM or revenue cycle management system for our healthcare industry. Okay, so let's go to the next slide. The first point here is integration and compatibility. This is very important point. Why? Because it is our responsibility to ensure that RCM system seamlessly integrate with your electronic health record or practice management system. As we are dealing with the healthcare industry, so it is understood that yes, we have some EHR, electronic health record, we have some practice management system. So your RCM system should be easily integrate with your existing EHR or practice management system. Then only it would be beneficial for you and it would be easy for adopt that RCM system. Second point means here in the continuation it is written that compatibility is essential for smooth data flow and reduced manual efforts. Okay, so let's say if you want, we are implementing the process because we don't want to include some manual operations, right? So in this case, if your system is compatible and smooth, if your system is compatible with your existing EHR and practice management system, then it will surely reduce your manual input. Okay, so this is the first point. Now we will move to the second point. Second point is functionality and feature. Evaluate the comprehensive feature of RCM system, including patient registration, eligibility verification, claim processing, denial management, and payment posting. The system should cover all the entire revenue cycle. So we have already learned about the revenue cycle, right? We know each and every parameter of the revenue cycle. So your new system which you are using should cover all these points, like patient registration, eligibility verification, claim processing, and denial management, along with payment posting. Okay, so this functionality should be with your system, the new system which you are going to onboard. Then comes into the picture automation and capabilities. Look for an automation feature such as automated claim submission, remittance advice processing, and denial management. Automation reduces manual error, accelerate processes, and improve efficiency. Okay, so we should always look at automation because we are going to implement every process element with some automation techniques, right? We don't want much include manual tasks, right? Because that's why we are going to implement this process. So it should support automated claim submission, remittance advance processing, and denial management. Okay, then only it will help us to reduce the manual errors, and it will also accelerate the processes and also improve the efficiency. So just assume a scenario, we have a piece of work which we are supposed to complete in 5 days, and it is taking 5 days. Now same thing if you are doing manually, or you can say same thing if you are doing with automation system, it would take only 2 days maximum. Okay, so you can see the difference. If you are doing something manually, then it is taking 5 days time, and if you are doing the same thing with the automation system, then it is taking only two days, right? So this will for sure enhance your efficiency, along with it will also accelerate your processes, reduce the manual efforts. Okay, so automation capabilities also should be considered while selecting the RCM process. Then comes into a picture claim management. Access the system ability to manage claims effectively. It should support electronic claim submission, real-time claim status tracking, and provide tools for identifying and resolving claims rejections. Okay, so your system, the new system which you are going to adopt, should support electronic claim submission, real-time claim status tracking. Let's say you are working on a system and that system is not providing you a track. it is not providing you a way to track your status, then how we can identify whether the system is completed, the process is completed or not, right? So it should support real-time claim status tracking mechanism. Along with that, it should provide the tools for identifying and resolving the claim rejections. Let's say if there is any scenario where the claim rejection is processed, okay, so in that case it should identify like, yes, the claim has been rejected, and also it should help in resolving that claim rejections. Then only it would be beneficial for our existing system. Okay, so these are the 4 points which we have discussed, and it should be considered while selecting the RCM process. Then we have coding and compliance. Ensure the RCM system supports accurate medical coding, because medical coding is very important factor in RCM process, and compliance with the industry regulations. It should facilitate ICD-10 and CPT code integration, as well as update the comply with changing healthcare regulation. Okay, so your RCM system should support the ICD-10 CPT code integration, and it should follow the proper norms and regulation provided by the industries. Then only it would be beneficial for us. Okay, so coding and compliance is also very important factor in terms of the points which we are considering while selecting the revenue cycle management or RCM process. Then we have patient eligibility verification. Verify that the system has a robust patient eligibility verification feature. This helps in confirming insurance coverage, reducing claim denial due to the eligibility issues. Okay, so you can see that it is our initial phase, right? So at the initial or at the beginning itself, there should be some features provided by the system that will help us in eligibility verification. Okay, it should because if you have eligibility verification feature, then it would help you in confirming insurance coverage, reducing claim denials, and which is caused by the eligibility issues. So there should be a robust system for that. Okay, then comes into the picture of reporting and analytics. Very important thing. Why? Because there should be some robust reporting and analytic capabilities are essential for monitoring and improving revenue cycle performance. So there should be robust reporting and analytic capabilities with your system, because this will help us to monitor and to improve the revenue cycle performance. So that's why we should look for a system that provide customizable reports, KPIs, which is key performance indicators, and analytics tool. You know that RCM is helping us in research field also. That's why it should provide proper reports, because by walking through the reports itself, we will identify whether the RCM process is providing the proper outcomes or not. If there is something wrong, then what is the reason behind that, how we can improve our performance. Okay, so therefore whenever we are selecting the RCM system, it should provide the customizable report, KPIs, which is key performance indicator, and analytics tools, because those tools will help us to identify whether everything is going in the good direction or not. Then we have user-friendly interface. Very important, because at the end multiple people are going to use your system, right? Medical coder will use, medical biller will use, and many other persons that are going to use that system. So it should provide user-friendly interface, because it is crucial for efficient utilization of RCM system. Ensure that it is intuitive and easy to navigate and comes with a adequate training and support. Okay, so your system UI should be easy to understand, easy to navigate. Let's say if any coder is working on your system, so he should not need to put that much of effort to learn the UI of your system. It should be easy, right? He should be able to easily navigate, he should be able to understand the flow, right? So it should come with adequate training and support, and even training should be less. It should not take that much of time to learn your system, and that is possible only in those cases when you have easy user friendly interface. Okay, so yeah, these are the point. Now we have security and compliance. Security is very important factor in any case, right? Because security is very important and paramount in healthcare. The RCM system should comply with healthcare data security standards such as HIPAA to protect patient information and ensure regulatory compliance. So security is very important factor, right? Your system should be scalable. Consider the scalability of RCM system to accommodate the growth of your organization. It should be able to handle an increasing volume of transaction and adopt the changes in your practice size and structure. Okay, so your system should be scalable. Then the next point is vendor reputation and support. Research the reputation of the RCM system vendor. Look for a customer reviews. Very important thing. We should look at customer reviews, case studies and testimonials as well. Additionally, inquire about the vendor's support service, response time and ongoing updates and maintenance. So these all are the point which is very crucial while selecting the RCM system for your organization. Cost and ROI. ROI, you know that ROI is very important for whether you are working in a healthcare domain or any kind of domain. It is important, right? So we should evaluate, because here it is mentioned, evaluate the total cost of ownership including upfront cost, ongoing fees and potential hidden cost. Consider the ROI in terms of improved revenue capture, reduced claim denial and operational efficiency. Okay, so these are the all point which we should take care while selecting a RCM cycle. I hope it is clear to all of you, and as we always do, there is one question for all of you. Just read this question carefully and write down the answer in comment section. That will also help you in identifying whether you are learning the concept or not, because we are going to ask only those questions which we have covered so far. Okay.